morning, the Bihar government has been facing a lot of criticism over what the opposition describes as fudging of the death toll figures. Now, after a recent Patna High Court order, which in fact ordered a death audit, the figure has risen to 9,429 deaths. 3,951 casualties have been reported after the death audit was conducted, which essentially means that there were almost 4,000 deaths that were not being reported in Bihar in the second wave of coronavirus. So the death toll in Bihar after the audit has risen by 72%. Now this audit was ordered after the Patna High Court, which is monitoring the COVID-19 situation, raised several doubts and questions over the death figures, and of course the state government then went ahead and set up a committee. So this was of course an exercise that was done by the Principal Secretary of the Health Department, who then announced the revised figures. Now, between March 2020 and March 2021, 1,600 people died of COVID-19 in the state total. And since March 2021 till June 2021, 7,775 people have lost their lives to COVID. So this is, of course, a huge discrepancy as far as the COVID death toll in Bihar is concerned, raising questions now of what this means. If every state actually goes ahead and does a death audit, would it actually make India's death toll, COVID death toll, much higher? Now, what's also interesting is that after the audit, there have been 2,293 deaths which have been reported in the state capital of Patna. But an examination of records of just 3 government-run cremation centers has confirmed 3,243 cremations done in accordance with COVID-19 rituals. So this is another revelation that has further put the spotlight on the COVID-19 numbers. But it's a shocking story we're tracking from Bihar. After an audit of deaths that was ordered by the Patna High Court, it has been reported that there is a 72% rise in Bihar's death toll, which means that Bihar was underreporting 72% of its COVID-19 deaths. We'll keep a close watch on all of these developments, also continue to examine what this means as far as the death toll in the country is concerned, and whether we need to in fact conduct more such death audits in different parts of the country.